All right, Landon, hit the disclaimer. Today, I'm going to do a podcast over bone health specifically. We have been finding more and more females with poor bone health at early ages. The recommended screening guidelines recommend to start a DEXA scan around age 65. We're finding women younger and younger with poor bone health. And so I wanted to bring a bone health expert on board to give us better insight on how to address this even decades prior to showing bone loss to help prevent this bone loss. And then hopefully help prevent fragility fractures, which you'll hear that a couple times. And what that means are osteoporotic fractures, where you have a fracture from poor bone mineral density. And he helps provide quality insight, how to prevent these and to develop a lifestyle that's conducive to positive bone health. The guest today is Dr. Doug Lucas. He's been making a lot of content. He has a thriving YouTube channel. He has formed what's called the Osteo Collective, where this is a community of individuals and they provide guidance on how to achieve optimal bone health. We'll have a link to this in the description, as well as a link to his YouTube channel and Instagram in the description. Hope you enjoy. My background is my first job as a nurse practitioner was in orthopedic surgery, and so I was in the operating room with a lot of these fractures, total joints kind of stuff, and then I went into emergency medicine where I did the bulk of my career. And so we see a lot of fractures in the ER, saw them in the operating room, and just how devastating they are to both the patient and even caretakers around them. And now that I've kind of switched to this hormone optimization wellness practice, I want to prevent that as much as we can. And that, is something that we need to be talking about even 10 years prior to that event. And so I'm here with Dr. Doug Lucas. He's graciously agreed to come on and provide some insight into hormones and bone health. And I was going to see if you could just give us a little background on yourself and what you've built with your Osteo Collective.
Yeah, absolutely. Well, yeah, thanks for the opportunity. I always love talking about these topics, especially with someone who knows a lot about hormones because it's such an important tool for people that are concerned about bone health and osteoporosis. So my background is in orthopedics as well. So you and I were doing some of the same stuff, just not in the same place. So I went through traditional orthopedic training, did a fellowship at Stanford in foot and ankle, and my first practice was really kind of lower extremity driven. Relatively big cases though, deformity, frames, all of the kind of crazy stuff that you see in orthopedics and lower extremity. And then I moved to Asheville from Colorado and did a lot more general work. So this is where I really started treating a ton of hip fractures, lots of osteoporotic driven fragility fractures, and got us a better sense of what was happening in the osteoporosis space, which we can get into. But it's really hard to get care for someone who already has osteoporosis, at least the care that they want. When I left that model about 7 years ago now, I did some additional training through A4M, really started getting interested in longevity, hormone health, optimization, lifestyle, all these things that you and I talk about a lot, and created a practice around it called Optimal Human Health, which eventually was built up, became very osteoporosis specific. And then we sold that to the company LifeMD, which I work at now. And we're building basically the same programs over again, but launching a women's health offering, relaunching our bone health offering, and then we're going to continue to work on the men's health side. They've got a big weight loss program too. So we're building out all those things at LifeMD. And I also have, as you mentioned, the Osteo Collective, which is our community for osteoporosis, people that want to improve their bone health more of in a DIY fashion. So that's where the career has led me to this point where I spend a lot of my time educating on my own YouTube channel, on different podcasts, different platforms, about the importance of understanding bone health, looking at bone health in a different way, which we'll get into, and just educating around early prevention and how critical it is to know what your bone density and quality is like.
Thanks, that's awesome. Yeah, and so you're extremely qualified to give any information for us. And so whenever I started this, I was getting, DEXAs on younger women. I mean, the typical guidelines are to wait till they're 65 or so, and it just even if they weren't even symptomatic, just kind of from my own curiosity. They were curious about their bone health as well. And I don't think I have gotten a normal DEXA at even in a mid 50-year-old. And some are just
Yeah.
already, negative 2.9 on their DEXA. And so they're already full blown osteoporosis. And these were women too that didn't even have a difficult menopausal transition. And so I bring on hormones at times for, bone, heart, brain health, even if they gracefully went through the menopause transition. And that really solidified that, okay, that was the right way to do it. And then, so one, we're finding it earlier and earlier. And then two, just the sheer morbidity that these fragility fractures have on patients. A hip fracture, the stats are always so profound. I've seen, 30 to 50% may die within a year. And of those
Yeah.
50% that live, don't get back to their original mobility. And so that just has such a profound impact on quality of life, health, and everything as a whole. And so I want to prevent that 100% if we can. And I do think that discussion happens years, if not decades, prior. And so I kind of wanted to get your insight on how do we start with prevention for these? Like, what is a good lifestyle for maintaining bone health? And then the follow up, does that change with these women that already have osteopenia or osteoporosis?
Yeah, for sure. So yeah, let's talk about the diagnosis piece first, because as you were noticing, this is what I noticed too. When I started getting into more of like the health span longevity space, you start recommending DEXA earlier and earlier for different reasons, right? For body comp or like whatever, you're looking at visceral fat. And then the bone health piece is sort of just like a secondary. You're like, oh yeah, and your bone density is this. And a lot of these devices, the DEXAs that are specific for body comp, a lot of times they don't give you a specific hip and spine bone mineral density anyway, but they'll give you a whole body bone mineral density, which is not great, but it's something. And I've seen, I don't know how many times, these young athletes, women in their 30s, 40s, and 50s that come in with a DEXA, specifically looking at body comp, and then seeing like, did anybody tell you that you have osteoporosis? And they're like, what do you mean?
Hmm.
Like nobody even mentioned it. They didn't even see it, right? It wasn't what they were looking for. And so my concern around osteoporosis, and the reason why I'm on such a mission to educate around early screening, is that we say, if you look at the numbers, like 200 million people across the globe have osteoporosis. That's known osteoporosis. And with recommendations like we have in the US, where the USPSTF is recommending 65 for women and 70 for men, we're not screening the majority of the population. And as you're noticing, as I'm noticing, even the people you would expect to have really good bone density, they don't. And so we have no idea how big of a problem this is. And so we need to be telling people, let's get screened. For women, absolutely, as you're going through perimenopause and menopause, if you're having a conversation around HRT, what are the risks and benefits? You need to know what your bone density is. You can't have that conversation without that data, or at least not accurately. So you really have to know at that point. But I would even argue that we really need to even go forward a couple of more decades. Let's go into your 30s, because so many adults right now are not developing peak bone density, or at least they're developing their peak bone density, but it's not good. And it's because of our sedentary lifestyle of our adolescents, of our teens, of our early adults, right? Highly processed food, poor mineral density in foods, avoiding animal protein, avoiding dairy. All these things are going to lead to poor bone quality. So you need to know what your starting point is, because we get surprised, like the woman you were mentioning in her early 50s, already almost a -3 T score. But where was she in her 40s? Where was she in her 30s? Maybe she started there in her 20s. We have no idea, because we don't have that track record, because we're not screening. So this is why it's really important to screen. And then you can say, okay, well, now I know, as let's say a 40-year-old woman, I finally get my first screen. I'm a decade too late, but here we are. I get my first screen through DEXA or whatever modality, and my bone density is low. Maybe I don't have osteoporosis yet. Maybe my T score is negative, 1, 2, something like that, right? Like it's low, but it's not terrible. I have low bone mass technically. So how does that change? Well, for that woman, we need to have the conversation to say, look, you need to know what's happening with your hormones first and foremost. They're super powerful tools. So if you have dysfunctional cycles, if you're having irregular cycles, if your estrogen is low or progesterone is low, or you ovulate, like all these things matter because you need that cyclic hormone balance in order to maintain bone for cycling women. And then what kind of exercise are you participating in? What kind of diet are you eating? The worse your bone is to start with, the more aggressively we need to lean into the things that we know are going to be good for bone. So many women are so focused on the skinny, right? And this is still true despite some big influencers and this movement of like stronger is better than skinny. I still see women just focusing on being skinny, right? So they live their entire life in this attempted catabolic state. If we're catabolic, meaning we're breaking down, if we're trying to lose fat, we're trying to get skinny, you cannot build muscle and bone effectively. So we need to then say, okay, for this woman who is in this situation where she has low bone density, maybe it's time to actually look at being anabolic. And then, you can pair it with some catabolic, right? Like we can cycle these things. Let's use all the tools that we can to build muscle and bone. And then we can back off, but we can trim up a little bit and you can maintain the shape that you're looking for aesthetically. It doesn't have to be all or nothing, but you can't live your whole life in diet mode. You just can't. It's true for men too, right? So we just need to focus on all the tools that are out there, of which there are many. Happy to get into them. But that's the big thing for me is screen and then understand hormones and then focus on the lifestyle piece.
Yeah, with starting to get into the lifestyle, I've seen, just tons of things that really start moving the needle some, but what are the biggest drivers for you for people to implement?
Yeah, so we have this like pyramid built out, which is probably the same as every like functional medicine treatment program out there. But we have the foundational pieces of the pyramid. And this is, foundation more important. The higher up you go, the less important it is. So foundational pieces would be number one, nutrition. Number two, exercise. Number three, sleep. Number four is, you could call it mindset, you can call it stress, you can call it a lot of different things, but some kind of a mental piece. And that's the foundation. So I'll go through each of those. From a nutrition perspective, again, I just mentioned under eating. I find that so many women are under eating just in general, right? They are just nutrient depleted. Therefore, they are macronutrient depleted and micronutrient depleted. Really hard to maintain bone in that setting. So we recommend that we really focus on protein.